Okay, we're going to start human body. We're going to start taking a big deep dive into how the body works. Basically, the consensus, or not the consensus, the content of this particular chapter is going to be how it works normally. When nothing's going wrong, when we don't have a trauma injury, when we don't have a medical emergency, what each organ, what each system is supposed to do without any problems, okay? When we get to that medical module, then we're going to start going over, okay, this is what can happen, this is what's happening when we have cardiovascular emergencies, or neurological emergencies, or renal emergencies, all of that stuff. So right now, we're just going to talk about how it functions day in, day out without any problems, okay? All right, so why do we need to know about the human body? Because you're going to be treating it, right? Guys, when it comes to assessment, when it comes to the body, you have to know normal before you know what abnormal is, right? You got to know what normal findings are so you can determine, oh, wait, that doesn't sound like it's supposed to, so that means something. All right, so again, we've got to know normal before we know abnormal. Again, we've just like med term, we've got to know these terms, we've got to know these conditions and the way that these things work to effectively communicate with other medical professionals, right? If you just bring in a patient and be like, they're having a heart attack, and you just say, that's what's going on, you don't know what that means, you don't know what's happening, so you don't know how your treatment is affecting your patient, that's not okay, right? We've got to know the ins and outs of everything just to make sure we're the most effective, efficient patient care provider we can be. All right, so we've got some landmarks, just like the med term, when we were talking about those terms, proximal, distal, superior, inferior, that we're going to refer to. All right, we just talked about the anatomic position. Can everybody on Zoom see me the way I'm standing? All right, so this is what we base the anatomical position off of. All right, and we've got different planes of the body that you're going to sometimes hear referred to, but they can determine that anterior versus posterior versus left versus right, okay? So the frontal is going to divide the body into a front half and a back half. All right, so you're taking a line, you're cutting my body in half to divide it into front and back sides. Okay, that's going to be your frontal plane. Oops. All right, your transverse or your axial plane is going to be like the old magician trick where you cut somebody in half, right? From the middle of your abdomen, it's going to cut into a top half and a bottom half, a superior and an inferior. All right, the sagittal, or more commonly referred to as a lateral plane, that's going to be from my nose all the way down. It's going to cut a line and say, hey, I got a right side and a left side of the body. All right, so that image should be in your book, but it just gives you a visual as to kind of how we're cutting the body in half, how we're dividing it by these planes. All right, let's talk about the skeletal system. What is it? Oh, I get to bring this up. Guy's brand new. The other one fell down. He had teeth missing. It was all janky. All right. So tell me what you know about the skeletal system. What does it do? Why do we have it? So structure, right? What is the skeletal system?
Bones.
Bones, right? Every single bone in my body forms my skeletal system. All right, so what do bones do? One of the things that give us structure, right? We have that upright, actually formed physical appearance because of these bones. If I didn't have bones, I'd just be like a big blob of skin. All right, so it gives us that structural appearance. What else does it do? Okay, so red blood cells. What do you mean?
Okay, I guess it's not really the bone, it's the bone there.
Okay, so inside of our bone, we actually produce red blood cells, right? So that helps towards my blood supply. Okay, what else does it do?
It protects certain organs like your heart and your lungs.
It protects. right? Because bones are what?
Solid.
They're hard. All right, so technically, yes, they are in a sense hollow because that's where we have that bone marrow, that's where those red blood cells are produced. But for the most part, they have a hard structure, so we can have it protect things. All right, so what important stuff do my bones protect? My vital organs. Guys, when I say a vital organ, that means if this organ wasn't present or it got damaged, I literally cannot live without it. All right, so what protects my brain? Is that vital to my function or no?
Your
Brain is
cranium.
very- right? So the bones that form my skull protect my brain. All right, what is this called? Your rib cage, right? So your thoracic cavity, we'll get there too. But what all is in here? What all is this protecting?
Your lungs and your heart.
Okay, so my heart's right here, right? I've got lungs on both sides, and I've got some really important vessels that also go right here that are very, very important to my circulatory system, my blood flow. Okay, we also have what we call our pelvic girdle. Okay, what's contained down here that helps protect? Mainly bladder, okay, but also again this gives us structure. Okay, so we have the bones. We also contained in our skeletal system, we have ligaments, we have tendons, and we have cartilage. All right, what's a ligament? I always get these mixed up. Ligament, bone to muscle to bone.
The other one's
Tendon is bone to bone. Ligaments are muscle to bone. All right, so again, the opposite. Damn it. Okay, so but we're gonna have these ligaments, these tendons, particularly in our joints, right, where bones are connected because they're not gonna be fused together. Let's give our elbow, for example. Right, these bones, this big bone up here and these bones down here, they're not connected as one long big bone. So we have those ligaments and those tendons and that cartilage in these joints, so we can still move around. We can have that movement, but we have those bones kind of separated and connected at the same time. What's cartilage? Okay, so guys, anytime you come up here, guys, during any break, you guys can come notice this kind of clear plastic looking substance. Also, you'll notice it in between the vertebra of the spine. That's all going to represent cartilage. Okay, so it is semi-flexible, but it's there to serve sometimes as like a shock absorber to make sure things are connected nice and securely. Okay, so again, that's going to be part of something that also helps make up our skeletal system.
Probably dumb, but why don't skeletons include like a cartilage model?
I don't know. I mean, also too, we have a that's called your pubic symphysis. You've got a cartilage ring down here that helps connect your pelvis to each other, or each side of the pelvis to one another. Question?
Yes, sorry, you broke up. What did you say for ligaments and tendons?
Referring to what? Like the
Like
definition?
the definition, yeah.
Let me look it up in your book. So a ligament is going to be connecting a muscle to a bone, and a tendon is going to be connecting a bone to another bone.
It's the other way around.
It's the other way, yeah.
Guys, this is embarrassing that I'm being
Ligaments
recorded,
are
but yes.
bone to bone.
Okay. Bone tendons are muscles to ligament to bones.
Yeah.
That's my one thing I've heard. Yes. Sorry. All right, so guys, we have the skeletal system as a whole, but then we have like two kind of subcategories that break up our skeletal system. Okay, we have our axial skeletal system. What is that going to contain? So your
It's like your appendages, isn't it?
So no, your axial is going to be that main vital function, your skull, your thoracic cavity, all right? So that's gonna be another word for your chest, or your rib cages. Your thoracic means chest cavity, and your spinal column, okay? What all do you think is included in your skull, your rib cage, your thoracic cavity, and your spinal column?
The most essential organs.
Right. So essential organs, yes, but also your central nervous system, right? We talked about yesterday, your brain is the motherboard of your body. This is where it sends all of those messages to make your heart beat, to control your blood pressure, to say, hey, can you actually feel and move those muscles and those extremities, okay? So that's going to be your skull, your spinal column here, the entire length of your spine, and your thorax or your chest cavity, because that's where your vital organs are. That's how your central nervous system is kind of hardwired and distributed to the rest of your body.
Are your spinal nerves inside of your spinal column, like inside the third, right?
Correct. They do eventually branch out.
Yeah.
But everything starts in the spinal column and then
Do the spinal nerves branch out from the gaps in the vertebrae?
yes, every nerve has their little kind of exit, and we'll talk about that. All right, so again, guys, we've got these three major components because we have vital organs. We have that vital central nervous system. That's why they're going to be pieced together for that axial skeletal system. Okay. All right, so let's talk about that a little bit further. We've got the skull, right? Guys, we're not going to get as in-depth. If you've ever taken like an AP class in college, you're not going to be able or be expected to label every single like 206 bones in the body. All right. Sorry? Yeah, it's not pleasurable, okay? But everything that I talk about in class today, I specifically name and label, you're expected to know, okay? So especially with the skull, guys, we've got 4 major plates that form our skull, okay? We've got one here, we've got one here in the back, we've got some here on the sides, and then we kind of have everything kind of in the middle down the center, okay? So the big part right here is going to be called your what bone? Your frontal bone, right? It's in the front of your head, okay? So that's going to be your frontal bone, okay? What do you think the bilateral bones on each side are going to be? Your temporal, okay? So just remember, if you're ever stressed and you're like rubbing your temples, kind of in the same area, all right? So your temporal bone, all right? Here in the back, so if you guys notice back here, so right here is going to be your occipital or occipital, depending on how you pronounce it. All right, and everything kind of in between that goes down the middle is going to be connecting everything, and that's going to be the parietal bone.
So, are these all then I mean, are these are the cranium?
Yeah, so right now I'm just talking about the actual cranium, and then we'll do the facial bones next. Because both the facial bones and the cranium all together make up the skull, but we're talking about the part up here that is more so covering your brain. All right, so frontal, temporal, parietal, occipital. All right, remember these terms because there's also corresponding areas of another organ that have the same name and same location. What do you think that might be? Your brain. You have a frontal lobe, a temporal lobe, a parietal lobe, and an occipital lobe. So that's an easy way to remember both of those locations because it's the same name, the same spot. It's just on your skull and your brain. All right, so your facial bones, the big major ones that you guys need to know. So who said it about the cartilage on the nose? Yeah, so Caden?
Yeah.
Caden was asking, so technically your nose from the base of the skull here till about right here, maybe the top third portion of your nose is actually bone. The rest of it is what? Cartilage, right? So that's going to be your nasal bones up until that point where it ends and the cartilage takes over, Okay, so when you break your nose, you're breaking the bones further up here. You're not breaking this kind of flexible cartilage aspect of your nose.
And there's 2 days of them?
Okay, so what are these guys going to be? All right, the bottom kind of foundation that help form your orbital or your eye socket. All right, so the zygomatic bones or your zygomas.
Like, is it cheekbones?
All right, you have part of your jaw that is fixated, right? It cannot move really around. It's attached to the rest of your bones. This top part of your jaw right here, or the top part of your mouth is called your what? Your maxilla. And then the movable part, if you ever hear that term, yeah, they're just flapping their jaw, which means they're just talking. All right, that's gonna be your mandible. Okay, so that's going to come together to form the mouth and the jaw, the maxilla, and the mandible. Okay, so it's important to remember too, this maxilla, this bony part right here, where does that continue? Into your mouth. Okay, so the upper part of your mouth, that roof of your mouth, that's going to be a hard, bony palate. All right, remember that, especially when we get to airway management. We'll talk about that later. But we can cause some problems if we come in contact with that hard, bony palate. We can actually cause an airway obstruction. So when we place a certain adjunct, we have to do it a specific way to avoid coming in contact with that hard, bony palate.
Are there 2 maxillas?
Kind of. It is really more so just one area. They do kind of form together a little bit right there in the middle, but for the most part, it's just one big. All right, guys, what do we notice that is right here? So it's a big hole in your skull, right? Is that good? I mean, yeah, sure, it's supposed to be there, right? But what does this do? What does this call first? Foramen magnum. Okay, so in the occipital region of your skull, you have an opening, right? What do you think is coming out of that opening? Okay, so that's where your spinal cord and your brain kind of meets and have that meeting point to say, okay, these are where all your nerves are going to kind of cascade down through your spinal column to go out to the rest of your body. Okay, so that foramen magnum is that opening that allows that continuity of the brain and that central nervous system. It's not technically a bone, but we need to be very familiar with that opening because we can have problems if that opening has, if it's compromised, if there's any pressure, we see some complications with that foramen magnum. We'll talk about that a little bit later. Yes.
On your, I don't remember what they're called. I learned it. Are your upper spinal vertebrae that's upper fused to your skull, or are they just like chilling in the hole?
They're just kind of chilling. They got really close proximity, but they're not fused. We'll get there. I think it's the next slide, actually.
Is internal decapitation really?
Yes.
What is that?
So she asked if internal decapitation is actually a thing. So yes. It doesn't mean that your head is actually literally severed from the rest of your body, but you can have a significant break, an actual total severance of the bones from that aspect of your spinal column in your neck, but you don't have like the soft tissue compromise. They can be totally separated, but your skin is intact.
You survive.
Depends on where it is and how significant it is, but technically, yeah. All right, so is everybody good-ish
Goodness.
with the skull, the cranium bones, and the major facial bones?
Do we even know all 14 facial bones?
Just the ones I just went over. Do understand though that when you go back into your nasal cavity, so when we're talking about the nose, you have a bunch of itty bitty small bones that make up your sinus cavity. That's going to come into play when we talk about airway obstruction and airway management. I'll go back over that, but you do have a bunch of little bones up there that can cause some problems if we have a bunch of damage to them. Okay. All right, so moving into that spinal column aspect of the axial skeleton. So guys, this is super, super important to make sure that our spinal column is nice and in line, it's intact, we don't have any structural compromise, because what is our spinal column home to? All of our nerves, right? It's a big component of our central nervous system. All right, so our spinal column is made up of these building blocks. We kind of talked about them in med term. Individual what? Vertebra, right? Or vertebrae, excuse me. All right, so they are going to be stacked nice and neatly on top of each other. They're not actually going to be fused to each other until we get down here at the very bottom of our spinal column. Okay, so we have different sections of our spinal column. We'll talk about those in a second. But guys, it's really, really, really important. You guys can come up here and look. You can see the better visual from the front. But know that while these building blocks, these vertebrae are stacked on top of each other, they're separated by what? Okay, so this little cartilage disc. Okay, so again, this cartilage right here is going to serve as that shock absorber. We're not actually going to be fused. Those bones aren't fused together, so we can allow for that different movements. But it's making sure that we're having the appropriate space in between each vertebra, because that is extremely vital that that space is there and that there's not immense pressure or it's not squished or anything like that. We'll talk about that in a minute.
But a lot of people will have
Correct.
So my mom has two slip discs in the back, and so that's like the cartilage that falls out.
So not falls out, but it kind of gets displaced. So it can be pinched, it can pinch some like pain nerves, it can hurt. It can alter like kind of the composition of the nerves that are supposed to go out through that space. It can cause some problems with those nerves as well. Yeah, it's painful and it can cause some issues. Okay, so let's talk about the sections of the spine, and then we'll talk about how important the spine is, what it actually does. Okay, so this very top part, okay, if we turn it to the back, we have got our cervical spine. Okay, guys, the top 7 vertebrae are going to create your cervical spine. You are going to hear this referred to as C-spine. Okay,
I'm sorry, can you repeat that?
which part?
The T-spine or T?
C. So C for
Oh.
cervical, you'll hear that referred to as C-spine.
Okay.
So a big thing in your scope of practice, you need to stabilize C-spine. You'll hear that term a lot, which means that you're going to make sure that you're holding that patient's head and neck in line and they're not able to move it. Okay. So the first 7 vertebrae are going to create your cervical spine. This is going to be your neck, okay, or your C-spine. All right. Then we're going to move down to the next 12 vertebrae that are going to create your thoracic region. All right, guys, so you'll notice your thoracic spine and thoracic cavity, that's all pertaining to that particular area of the chest. Okay, so you've got your thoracic vertebra, and then you have your thoracic cavity, but these next 12 are going to be your thoracic spine. Okay, so yes, we'll come back to that. All right, the next 5 are going to be your lumbar spine. That's going to be kind of how we have, where we have that little curve, the lower part of your back. All right, so those are going to be 5 that create your lumbar section. And then we have the sacrum and the coccyx. Okay, so the sacral vertebra, guys, this is actually going to be, they're fused together. They are one big bone, one like kind of curved plates. What do you think we use this for? Why is this here? Why is it fused together?
Isn't that like the lip above your like? Stairs.
When I sit, that is mostly what I'm putting that weight on, is that sacrum. That's why it's curved and that's why it's fused, so it can better support my weight when I sit down. Okay. And then we got our little guy down here, our coccyx.
That's a good one.
This is technically, if like you hear anybody who breaks their tailbone, it's this guy down here. All right, it is connected. These are fused together, but the connection to the sacrum and the coccyx is not super durable and strong. It's kind of a little like flimsy, kind of out here on its own. But yeah, this is going to be your tailbone. You can break these bones, you can chip them, all that stuff. You can bruise your tailbone. You're doing that to your coccyx.
Is the coccyx fused to the sacrum?
So the bones itself and the coccyx are fused, but it does have a flexible attachment to the sacrum. Everybody still with me? Okay. All right, so guys, you need to know the numbers in the different sections of your spine, okay? Because you need to know that just because your cervical spine starts here, it's not going to continue all the way down here, right? So the stupid, quirky way that I have a lot of these. You're going to think, man, she's such an idiot or she's a nerd, but you know, it's easy to remember. So relate the numbers in each section to the times of day that you eat. All right, so we have 7 vertebrae in our cervical aspects. Let's eat breakfast at 7 a.m. Okay. In the middle of our spine, in the middle of the day, we eat lunch, and we'll eat lunch at 12 noon. You got 12 vertebrae in your thoracic. If you're an elderly person who goes to bed super early, at the end of the day down here, we'll eat supper at 5. Your lumbar has 5 vertebrae. And then somebody else came up with a good analogy for this. I can't remember. So maybe eat dessert like 5 minutes after supper. Your sacrum has 5. And then I always refer to the coccyx as, if anybody remembers Taco Bell used to have the slogan, the 4th meal, right? Because they were open till like 3 a.m. So if you get up to get like a super midnight late snack, that 4th meal, you've got 4 vertebrae in your coccyx. I wish I could remember what my other students said because I really liked it. I can't remember. So kind of loosely applicable to times of day that you eat, but you do need to know the numbers in the different sections. Okay. Also be aware that the numbers in each section start at the top and count down to the bottom. All right, so this guy right here, this is going to be what we would refer to as C1. It is the first vertebra in your cervical column, or your cervical section.
What's above C1?
The foramen magnum.
Oh,
All right, so when we get down to that 7th, where we move into the thoracic, all right, this top part right here, the first bone of the thoracic column, is going to be T1, T2, T3, T4, T5, and all the way down to 12. I don't think I'm on the exact right vertebra down here, but L1 will start at the very top and count down L2, L3, L4, L5. Okay, so sacrum is S. Really, it's all one thing. It's all fused, right? But you can see the difference, kind of where they would be separated if you come take a closer look at it.
So is it like 1, 2, 3, 4, 5, 6, 7, and then 1?
Correct. So C 1, 2, 3, 4, 5, 6, 7. T 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12. Does that make sense to everybody? You don't count from the bottom up. You count from the top down. Okay, and that's important too, guys, because when you are doing your assessment of the back, that's one big thing that we're looking for to see if these are all where they need to be. And if we notice a deformity or something that's not right, like an abnormality, we need to be able to count down and be like, okay, so I've got some step off around the C5 area. That needs to be conveyed in your radio report, right? That's a significant finding, and we need to give an approximate location as to where we find that abnormality, because that can mean different things. I'll talk about that a little bit later on. But an abnormality up here means a lot of difference in presentation and severity than maybe like down here. That's why we need to give an approximate location of that abnormality we find.
Instructor A.
Yes.
So would you not number the vertebrae and the coccyx?
Not really, no. Again, you can kind of, if you get an up close look at the sacrum and the coccyx, you can see if they were separated. You can kind of get like that definitive, oh, that's where they would have a break. But really, the coccyx is so small, we just kind of refer to that as just one whole appendage.
Okay, thank you.
Mm-hmm. All right, let's talk about the spinal column. Why do we have it? What is it home to, and why is it important that it stays in the structure that it's in?
There are a lot of nerves in your spine that
Okay,
it protects as
there are a lot
well.
of nerves. Is that it?
Yeah, I was just saying that's basically your nerve highway. Like that's where you're have the ability to move your legs and move your arms, because if anything happens with that can affect any of your extremities.
Okay, so it's your nerve highway. Melody already stole my thunder for my analogy, but we'll get back to that. Okay.
It's also like a really big, it plays a really big part in the circulation of your spinal fluid.
Okay. Right. Okay.
Oh, I was just gonna say.
All right, so guys, again, brain is our motherboard of our body, right? It gives me all of these messages, all of these signals as to how to tell my heart beat faster, beat slower, make my blood pressure go up or go down, control my body temperature. Everything that happens in my body comes from my brain. Crazy, right? That little squishy ground beef looking stuff controls everything. Function, thought, creativity, screaming out in the middle of the night that you want a sandwich. I mean, it controls all of that stuff, okay? So we've got to make sure we have a nice connection from that motherboard to all of those nerves that are gonna go send out those signals to my heart to beat, to my muscles to move, to my circulatory system to control my blood pressure, okay? So like Melody said, that foramen magnum, that's the opening between the brain and all of my nerves, my central nervous system come through. Guys, you've got hundreds of nerves. Yes.
So I know that the spine is part of the central nervous system, but is it like as soon as the spinal nerves get out of the spine, then they're part of the peripheral nervous system?
We'll break down that because there are a lot of subcategories for.
Yeah.
Yeah. So yes and no, but we'll get there. All right, because notice right here in this illustration, all of these yellow things are nerves, okay? Where are they coming out of?
Yeah.
These little spaces in between my vertebra, my cartilage disc, right? Okay, so guys, consider your spine is Highway 75, all right? Each one of these little discs are an exit ramp for the appropriate nerves to go out to that part of your body to control the function and the sensory part of that particular part of your body. Okay, so let's say we've got 75 MLK exit, right? At this exit, all of these nerves that are going to go out and control, let's say, you know, the function of my kidneys, right? They have to be able to get off of that exit, and now they're going to go take all those different side streets to get to my kidneys, to get to all of the extra functions that they do to do their job. All right, that is why it is so important that these vertebrae stay intact and in line, and we don't have any structural compromise. All right, because what happens if you are driving down 75 and there's a roadblock on your MLK exit? What's not happening right here at this disc, at this exit spot for these nerves? The nerves aren't getting off. Those messages, those functions that need that exit ramp to go do their job and tell the rest of the body to do its job, it's not getting through. It can't get off. So whenever we have any type of like a broken back, or we break or compromise vertebral structure, we close off an exit ramp. And whatever nerves are supposed to take that exit ramp to go to that aspect of the body, they don't get those signals going through. Your brain might be telling you, hey, dude, get off the MLK, go tell the kidneys to do whatever, okay? But if there's a roadblock there, they can't do their job. That's where we start to see like paralysis, okay? So if you have a back injury, a spinal cord injury, if it is like an injury, say here, all of those sensory nerves that go down to your legs to tell your muscles to contract, to move, to be able to feel pain, all right? Their exit ramp is blocked. They can't get off. They can't do their job. Even though the brain's telling them, hey, I really need you, like, just flex your muscle and do this and you can walk again. The exit ramp is closed down. They can't get out there. The signals aren't getting to their end destination to tell that specific body area or body organ what to do, how to function.
So like if you have a closed, like say lumbar 2 or L2, so does that just like block off L3, 4, and 5 as well?
Typically, yeah. It's kind of like a cascading effect. So that's why we said if I have any type of suspected spinal cord injury way up here high at my neck, all right, then that means potentially, probably most likely, all of these exit ramps from that point down have been compromised. All right, so that's why if you have a higher up spinal cord injury, we typically see all 4 extremities are paralyzed. The lower down the spinal cord you go, you can see that they might have function of their upper extremities, but their lower extremities are paralyzed.
So would that be more traumatized? Because I know I have 2 herniated discs in my neck. So that manifested itself years ago and I did lots of problems with it. Right, so it ended up being specific to that.
Yep.
That's the type of injury. So I'm asking, do you see more traumatic injuries? Is that why you have these multiple kinds of effects?
So yes, it is probably a majority of the time from trauma. But it can be from medical issues as well. And we'll talk about that. That actually was the case with my cousin. It was a medical issue that stemmed his paralysis, not trauma. So we have
Couldn't hear us.
saying, yes.
We couldn't hear his question.
Oh, so he was saying he's got 2 herniated discs, which means they're either kind of like bulging or they're kind of moved. They're kind of slipped out of where they need to be. And he said that he had specifically like issues with the left side of his left arm. But we were just correlating that because he had those issues with that exit ramp, it's specifically to those nerve endings that are supposed to control the left side or his left arm. That's why he had those issues.
Gotcha.
Most of the time we see this paralysis and these nerve issues secondary to trauma injuries, but I did say you can see that from a medical problem as well.
Right. Okay.
Infection, a lot, most of the time it's gonna be a type of infection.
So the body's starting to fight it, shutting certain things down so it can do what it needs to do.
Kind of. It's just if you have an infection that manifests itself like in the cerebrospinal fluid or around these areas like meningitis, the bacteria or the virus that's there can attack and start to like compromise the nerves and the vertebral disc, stuff like that. We'll get there. So is everybody okay-ish with your spine being your 75, I don't care, 285, 20, whatever you guys take, whatever highway that you guys want to refer it to, those intervertebral discs That is the fancy pants term for them, the intervertebral disc, right? These little cartilagey cushions that help separate and create that exit ramp, that opening. They have to be intact for those nerves to go off to that particular part of the body that they're assigned to and make that part of the body work. Okay? Okay. Questions, comments, concerns? Moving forward. Everybody's good. Okay. Now, going to talk about the thoracic cavity, the rib cage. Okay, so what did we say we have our rib cage mainly for? What does it do?
It protects our organs.
Right, to protect those vital organs, those heart, those lungs, what we call the great vessels. Okay, so it is made up of several different, bones. All right, starting up here, who is this big guy? So we've got like our plate, our armor plate right here. We've got our ribs, spoiler alert, and this kind of comes together to help
Sternum.
that spherical shape. So this is the sternum, right? Okay, so there's a little kind of divot up here. You can feel it on yourself. That's called your sternal notch. That's where the top part of your sternum starts, and then it goes all the way down. I don't like this one as much because it doesn't show it as well. To this little guy right here. So we have the top, the sternal notch, this main big kind of upper, thicker part of the sternum, or here to the xiphoid process. All right, this is a little better illustration as to what it looks like, but it is connected to the entirety of the sternum, but it's kind of like the coccyx. It just kind of, is out on its own. It's a little flimsy. It's not as secure. All right. Why do we need to be super well versed in the anatomy of the sternum and the xiphoid process?
Because that thing can break.
Okay, so yes, guys, for CPR, you've got to know the proper hand placement, where you're placing it in relation to the sternum to make sure you're doing it correctly. Because if you place your hand too far down on the sternum, what are we going to be pushing on? The xiphoid process. It's not very securely attached. It's just kind of free floating out there. What's going to be a problem if I'm pressing on that xiphoid process versus the body of the sternum? I can break it off. Literally, like I can detach it from the rest of the sternum.
Are your clavicles considered part of this?
Of the sternum?
No, like of like the thoracic.
Ish. All right, guys, what happens to bones when they break? What are they? They're sharp. They don't break and they're nice and round and smooth on the edges, right? They're going to be sharp. And if I am forcefully pushing that broken, sharp piece of bone down into my patient's chest, what can I do?
You're gonna lacerate an organ.
Yeah, it can cause a lot of damage, right? You can puncture a lung. You can put a hole in your heart. You can lacerate an artery, right? So that's what goes into play. So when you guys are trained and certified with CPR, that's why you're not covered with Good Samaritan anymore. Because now you know the exact reason where we place our hand, like it's very important. And if you're doing it incorrectly, you're going down too low and you cause damage, you're not covered anymore because you know better. You know why we place our hand where we do. Okay?
So is it common to break the sternum? Or just is that?
So not, if you're doing it incorrectly, it's common to break the xiphoid process. But what's common when we break ribs is common if you're doing it correctly during CPR. I'll talk about that. So is everybody good with the sternum, sternal notch, the manubrium, the body, and the xiphoid process?
I have a quick question.
Yes.
Does the xiphoid process serve any function?
Not really, just kind of there.
Okay.
Like the coccyx, it's just kind of hanging out.
Yeah, okay.
All right, So we're good with the sternum. All right, so now what is connecting, or not connecting, but what forms like the spherical shape of my thoracic cavity? My ribs, right? I have ribs bilaterally. I have them on each side, and I have 12 pairs, right? So from top to bottom, I've got 12 ribs on each side. And notice they're not really fused to my sternum, right? What's connecting my ribs to my sternum? Cartilage. Okay, so again, this is semi-flexible, this cartilage, and it serves as a connective tissue for these bones to come together to form my rib cage. All right, so you guys heard me use the term that you break ribs during CPR. Guys, usually we don't technically like break or cause a fracture in the rib itself. What you will feel, what you'll hear, and the injury that we typically cause, which is common, right? We are actually separating the rib from the cartilage. We're not really breaking the bone itself, but we're just kind of causing that disconnection when we push on the sternum from that pressure, from that external force.
Does that ever recover afterwards, or is that?
Yeah. It's just like it'll grow back together and fuse back together. All right, so we'll talk about that more on CPR day. It gives you kind of the heebie-jeebies when you feel it, because you're gonna feel it. But that's what's happening when we break a rib during CPR. We're separating that connective tissue with the cartilage.
So when you like break a rib, you're not like a lot less likely to cause damage. The backward process.
Yes.
Like smoother.
Yeah. Yeah. Okay. All right, so we talked about that. All right, so guys, again, this is all forms to help protect our vital organs, right? So our heart, guys, your heart's gonna be about the size of your fist clenched up. Not super big, okay? It's gonna sit right about here. So if you notice, that's why we push on the sternum. We're trying to use the sternum to push and pump the heart because it's not doing it itself, all right? You have lungs bilaterally on each side, and then you also have these great vessels that we're going to talk about when we get to your circulatory system, but we have a bunch of big kind of pipes that help control our blood flow and our blood pressure that stem from the heart that go through your abdominal cavity, through your chest cavity, out to the rest of your body. Okay, and this is all formed to help protect it.
What's the anterior ribs? Like, what is it?
So just the front versus the back, because guys, they're long, right? You've got some aspects where they're much more prominent on the posterior side, and then as they curve around, they're much more prominent on the anterior side. All right. Notice down here too, you guys, we have what's called like a floating rib. It's not directly. You've actually got two, not directly connected to the sternum via the cartilage, but it still is there to serve some type of protection. Okay. Everybody good with the thoracic cavity?
Is 12 one of the ribs?
Sure. I don't know. I know I've heard of some like gymnasts that need to be like more flexible to have them removed, like Olympic gymnasts and stuff.
I've got a quick question.
Okay.
Just to clear up, you said, so like the diagram that you have displayed right now, the blue is cartilage, right?
Correct. Yeah, all of this thing that's indicated in blue, that's going to be the cartilage that's going to help connect the ribs to the sternum.
Okay, awesome. Thank you.
Then you can also see the cartilage, the intervertebral discs in the spine as well. So guys, just so you're aware, the medical term when we're referring to a rib, does anybody know what that's going to be called?
Costal.
Cost. All right, so C-O-S-T or costal is going to be referring to a rib. There's also a term you need to know that we're going to talk about a good bit called maybe like an intercostal space. or an intercostal muscle. What do you think that means?
In between.
In between your ribs. So there are spaces in between your ribs, and there's also muscles that are in between your ribs that help you breathe. And we'll refer back to that more so when we get to respiratory emergencies. But COST is going to refer to your ribs itself, the actual bone, and intercostal, either muscle or space, is going to be that void space in between the ribs. Okay. All right. I think this is a good stopping point because we're going to talk about more bones and the different parts of the other skeletal system. So if nobody has any questions, anything so far, we'll take a break here. We'll take an hour for lunch. You guys just come back at noon and we'll knock out the rest of human body. Okay. Everybody good on here?
Yes,
If
ma'am.
we, I have a question.
Yeah, we're good.
Somebody had a question.
Yes, if we leave the Zoom chat, will you let us back in?
Yeah, so at noon, it'll pop up that you're trying to come back in, and then I'll admit you back in.
Okay. Are we coming back in at 12 or 1?
Ooh, thank you. 1. Guys, be back at 1.
I was just about to say, did daylight savings occur?
Eat really, really fast. So yeah, y'all be back at 1, 1300.
Okay, perfect.
All
Thank
right.
you.
Thanks.